What is up, everybody? Dr. JP Guidry here. I want to take a few minutes today to talk a little bit about elbow pain and how we go about treating it. So for the purpose of today, we're going to kind of talk mainly about tendonitis type pains and just similar kind of acute repetitive use onset pains. You know, most people are familiar with the terms tennis elbow and golfer's elbow. Tennis elbow tends to be more correlated with medial elbow pain. Golfer's elbow tends to be more lateral elbow pain. Both generally are due to overuse type activities, repetitive use activities, increase in repetitions, doing maybe an activity where you're using your hands and arms more or more than you normally would, or maybe a new activity, doing a lot of painting or something like that. As well as within sport, so for golf, maybe upping your reps, practicing more, changing grip or technique, hitting off of mats, things like that, doing something different or increasing something over a short period of time. So when we talk about elbow pain, specific to these kind of tendonitis, tendinosis type issues, is the number one thing we do is have to give it time. So there aren't a lot of shortcuts necessary with this. It doesn't mean that all incidences of elbow pain will last a long time, but it's not uncommon for those type of issues to take up to 12 months for full resolution. It doesn't mean we have to just kind of sit around and do nothing over that time, but it is important to have an understanding of this time frame so we can be patient and understand that if things aren't getting better as quickly as we like, it still may be a normal process with these type of issues. Number two is activity modification. So that may be kind of backing off of repetitions. That may be changing how you perform certain activities. Again, if it's a golf swing, it may be playing around with different grips, looking at how your body moves throughout the swing and mechanics, and maybe changing some of that, as well as kind of assessing the other areas of body and how they move, and make sure that some limitations in other areas aren't putting increased stress on the elbows. Things like hitting off of mats, we tend to see because there's not as much give, that impact can sometimes cause problems, so changing that. And then, outside of golf, so any other activities that bother it, modifying or changing how you go about those activities, at least for the short term until things calm down. Number three is progressive loading of tissue. So as we kind of progress back through the healing process, we want to start loading the painful tissues. The way we tend to kind of do this is we try to start with eccentric loading and isometric loading, and I'll show you kind of an example of that. And then we progress back to concentric loading, which would be kind of your dumbbell movements through full range of motion, any exercises that are going to load that elbow through a full kind of typical exercise range of motion. Eccentric, so that's going to be, let's say we have lateral elbow pain, that's going to be controlling the, so concentric would be bringing the wrist up, eccentric would be controlling that wrist down. So this TheraBar is one of the best tools you can use for elbow pain. There's actually a fair amount of research kind of tying in the benefits of that, but there's other ways to kind of load it with dumbbells and bands and things like that. So for the eccentric portion, what you're going to do is take this. You're going to take your right hand, so the painful elbow is the left elbow. Take your right hand, set it like that, and then we're going to slowly let that left wrist go into flexion. Okay, so concentric would be pulling that back up, which would be the later stage, and then isometrics would be kind of holding it mid-range against that resistance for a period of time. So we tend to start kind of with the isometrics and the eccentric portion of those first, and then progress back into the full concentric range of motion. And again, there's plenty of ways to do this. Just want to show you a demonstration with a TheraBar because there is some research that shows the benefits of that. Lastly is going to be stay active. So we want to keep you active around the pain. So we want to keep playing golf. We want to keep playing tennis as much as we can. We want to keep working out, even if we maybe have to avoid certain exercises or play with our grip on certain exercises, so that we can keep training and stay active to train not only the tissues that are painful, but also the rest of the body around it. As well as kind of getting assessed, looking for maybe issues up and down the chain that within our sport or in your sport that could be putting excess stress on those elbow tissues. So it's definitely important to get assessed especially if your pain isn't going away as quickly as you think it should. But also understanding that with these type of conditions, there is a time component to it, and everybody is going to heal a little differently, progress a little differently, but we want to be patient with all of this and not kind of freak out and start taking drastic measures because we're not better in 2 to 3 months. But we do want to make sure we're taking an active approach to our recovery, making sure you get a proper diagnosis from a medical professional, and guidance as needed to progress you along the way. So if you're experiencing any elbow pain, please feel free to reach out to me, johnpaul@guidrypt.com, or you can find me on social media, Guidry Golf and Sport, Barbells and Birdies on Twitter. Feel free to reach out on those avenues as well. So everybody has a good rest of your day. Hope this information helps.